spring, it is here, and so is the sneezing, the itchy eyes, and the congestion. If you have allergies, you know you are miserable, and you are not alone for sure. Dr. Evelyn Lomasney with Health Allergy and Asthma Center of North Carolina, here to share expert advice on easing those symptoms and tackling spring allergies. All right, let's just start. How can someone tell if their symptoms are actually from allergies versus a cold or like COVID?
Yeah, that's a good question because we've had a really late cold flu season, so things are still circulating. In general, I tell my allergy patients that allergies do not cause fever. So if you have a fever, I would, think more flu, COVID, some of the viruses that are going around.
Okay, the next question people ask when they figure out it is allergies, okay, if it is that, how long do these symptoms last? Is it all season long? Is it part of the season?
Usually why the pollen count is high. So we see tree pollen in the early spring, which is right now. Grass pollen tends to come out in the late spring, and then fall is our weed pollen season. So if you are an unlucky person and allergic to all three, you're looking at symptoms from kind of mid-March to October. So it really depends on what you're positive to. And then in general, I say about 4 to 6 weeks of high pollen days for each of those.
4 to 6 weeks of miserableness. Okay, got it. And that's only if you're allergic to one of them versus all three of them. Okay, got it.
Yes.
So what should we know about taking the over-the-counter antihistamines for allergies? Like, for example, how long does it take for it to work and for us to know, okay, this is what I should be taking?
So they give pretty immediate relief. So I would say if you're having symptoms and you think it's allergies, taking an over-the-counter antihistamine, you should know within a day or two if it's helping. Most of the time I hear that they help, but they're not enough. And then you can add something like a over-the-counter nasal steroid or nose sprays can really help as well, in addition to the antihistamine. I would say how you use it depends on how severe your symptoms are. So if they're mild and you don't have symptoms every day, take it as needed. For my rule of thumb, though, is if you're taking it more than 50% of the time, just go ahead and take it daily through the season, and you'll probably feel a whole lot better that way.
Yeah, I wish it didn't make me feel so kind of foggy.
Right. So I would say if you have the sleepiness that comes from the antihistamines, try different ones because some people tend to tolerate one versus another. And so don't write them all off. They really are very different, but they'll all work for allergies.
Okay. Are there home remedies that could also help ease our symptoms, or maybe some common mistakes that we are making that we should stop doing?
And unfortunately, I don't know of a ton of great home remedies. I know a big myth is the local honey. It tastes delicious and it might be great in a tea, but it really doesn't help allergies because that pollen is from the bees, and that's not the pollen that you become allergic to. We become allergic to the wind pollinated plants, so that when you step outside, you might not be able to see the pollen, but you're going to feel it.
Okay, so let's go back to then the maybe common mistakes people should avoid.
A big one I feel like is people don't underestimate how much pollen is on their clothes and their hair and their skin, and really showering or changing clothes after being outside can be very helpful. Another big mistake, especially if you have eye symptoms, don't rub your eyes, because you're just rubbing that pollen in your eyes. So get like a cold compress or a paper towel and wipe the eyes. I think one of the big things I see is people don't reduce their pollen exposure in a lot of non-medicine ways that we can do, and that can be really helpful.
So how do we reduce our pollen exposure?
Sure. So we call them avoidance measures. One of the big ones is keep your windows closed. It might be nice and breezy, but those windy days tend to be the biggest pollen days. And again, if you're going to be outside, shower, change your clothes when you come inside to get rid of that pollen. Early morning tends to be the highest pollen count. So if you have to go mow the grass, don't do it early morning and on a windy day.
Let's continue the conversation. At what point should someone consider seeing a healthcare provider to get relief for their allergies versus just taking the over-the-counter meds?
So I use a lot of over-the-counter meds in treatment for patients, and I would argue at any point if they want more information or options to reduce medicine use, In general, though, if they're taking, an antihistamine every day and it's not enough, I would say go seek your healthcare provider because we've got other options. You don't need to be suffering out there.
Okay. I'm sure that there are some symptoms that are red flags that we need to seek immediate medical attention for. So what are those red flags, and then what kind of attention? Where do we need to go?
Sure. The big one we worry about with environmental allergies is asthma-like symptoms. So if you're outside and it's a high pollen day and all of a sudden you're coughing or wheezing or short of breath or have chest tightness, that should be, you should go seek healthcare. And I would argue it kind of depends on how severe it is. Really severe symptoms, if you're having a hard time breathing, then you're going to urgent care or the ER to get treatment for that. If it's more mild and subtle, I would start with your primary care or come see an allergist. And we definitely worry about those asthma-like symptoms probably the most.
Okay. We hear about allergy shots and people on allergy shots all the time. At what point should someone consider allergy shots, and then how do they work?
Sure. So I tell people there are three things an allergist can do: tell you what you're allergic to and how to avoid it, make recommendations for medicines to try and prevent you from having symptoms, but really that allergic reaction is still going in the background. And the third is allergy shots, or what we call immunotherapy. And with that, what we do is we give you targeted doses of what you're actually allergic to at targeted intervals to retrain your immune system. So instead of going outside and recognizing pollen in an allergic way, we make you non-allergic to it. So it can be a cure. And who really do I recommend shots for? Anyone who wants to reduce lifetime use of medication, so it's always an option. Anyone who's having side effects from the medicines, or they're not enough, they're not working. Anyone who it's causing their asthma to flare or bad allergic skin disease. And anyone actually with animal allergy, an animal in the house, if they're allergic to their pet. That's a tough one. That is one where we recommend allergy shots because they're fighting an uphill battle.
All right. What happens if we're not allergic to our pet, but our pet is probably making us feel bad because they're bringing the pollen into our house?
Yes, that definitely is a thing. Just like we were talking about those avoidance measures you can do for your clothing and yourself, apply them to your pets because they're going to bring that pollen in from outside and put it all around your house. So more frequent pet washing can be helpful to get rid of that pollen. Or same idea, maybe don't have them go out in the early morning. Unfortunately, like that's dog walking time, right? But that's also where the pollen counts are the highest.
I kind of told you that I feel like really foggy when I take my medicine, and then you suggested, if one doesn't work, you should do another. But my next question is, should you take it at night versus in the morning, or does it not matter?
So great question. There are some that actually probably work better taking at night. And there's some that it doesn't really matter. You want to take a 24-hour one. So those are the newer ones, not like tried and true Benadryl. And those you can take at night if they're making you sleepy, and it will still give you relief throughout the day.
Okay.
So it doesn't matter, but if it's making you sleepy, try taking it at night.
Okay. And are allergies hereditary like other things?
Yes, so there's a big genetic component to allergic disease. It's not always a one-to-one, like you have seasonal allergies, so your kids will, but the tendency towards allergic disease runs in families. So there's a big genetic component. So yeah, in our practice, we see whole families because everyone has allergies.
Gotcha. All right, we got a little bit less than a minute. What kind of final thoughts do you want to leave us with when it comes to allergies and symptoms and treating it?
We have a lot of treatment options. So my biggest thing is you don't need to suffer out there. A lot of people think, oh, it's allergies, I'll just suffer through these few months and then I'll be fine. So don't hesitate to reach out to your doctor or come see an allergist. You don't really need to suffer, and don't underestimate allergies. They can make you pretty miserable. And so for kids, school performance and things like that, people have to call out sick, people get sinus infections. We really can get you to the point where that's not happening anymore. So yeah, don't hesitate to reach out.
All right, sounds good. Thank you for your time and your expertise. And if you missed any of this, maybe you need to send it to a family member or a loved one who deals with allergies. We're going to have this in the To Your Well-Being section of our website.